The Council was informed that the humanitarian community was working relentlessly to stop the spread of the polio virus, a disease the world largely had under control, as the UN and its partners continue to battle unconscionable obstacles in meeting the needs of the population on the ground.
Israel has facilitated the entry of all requested polio vaccines, along with the equipment required to implement the immunization campaign. What is now most important is to ensure both the security and access needed to implement the campaign effectively. I don't need to tell you how disastrous it would be if we were unable to contain this preventable disease, a disease that knows no borders. The same access must be afforded to all life-sustaining supplies and services in Gaza.
The WHO plans to vaccinate up to 640,000 children under the age of 10, confirming that over 1.2 million vaccine doses had already been procured and are now available for administration in Gaza. The campaign starts Sunday, September 1st, staggered in 3 phases of 3 days each, part of a 2-round campaign which will require a second dose to be administered after 4 weeks.
The current outbreak in Gaza is a stark reminder of how quickly infectious diseases can re-emerge where health systems are compromised. Many other diseases are spreading, while our collective capacities to prevent, detect and respond to them continue to be hindered. We welcome the commitment to area-specific humanitarian pauses and suspension of evacuation orders for the implementation of a 2-round polio vaccine campaign set to begin on the 1st of September in the Gaza Strip. During each round of the campaign, the Palestinian Ministry of Health, in collaboration with W.H.O, UNICEF, UNRWA and other partners, will provide 2 drops of WHO pre-qualified novel oral polio vaccine type 2, NOPV2, to more than 640,000 children under 10 years of age. The first campaign has a phased approach, starting with central Gaza, followed by South Gaza, followed by North Gaza, each area covered over 3 days.
Dr. Ryan stressed the importance of the parties adhering to the agreed terms, warning that at least 90% of coverage was needed during each round of vaccinations in order to stop the outbreak and prevent an international spread of polio.
Vaccination coverage will be monitored throughout the campaign, and it has been agreed that vaccination will be extended by 1 day wherever necessary to vaccinate all children. From our experience, we know an additional day or 2 is very often needed to achieve sufficient coverage. The pauses will allow children, families and health workers to move safely, ensuring that vaccines are administered efficiently across all zones. The safety of every single one of the 2,180 vaccinators must be guaranteed. Their security is paramount. We urge all parties to ensure their protection, as well as that of health facilities, children and their families.
With calls from UN officials for strict adherence to international humanitarian and human rights law, including the urgent need for a ceasefire throughout Gaza, the release of all 107 remaining hostages, and the unhindered provision of humanitarian assistance throughout the enclave. The World Health Organization also reminded the Council that the polio outbreak was occurring within a much larger public health catastrophe in Gaza. With only 44% of 132 primary healthcare facilities functioning, only 17 out of 36 hospitals were providing services, most of those only partially, compromised by physical damage, the lack of fuel, limited medical supplies and the loss of staff, among other impediments. And as the acting head of UN Humanitarian Affairs, Joyce Msuya, told the Council, quote, "What we have witnessed over the past 11 months and continue to witness calls into question the world's commitment to the international legal order that was designed to prevent these tragedies." Shervin Riceby's SABC News, New York.